My name is Christy Nodding. I'm a nurse who works for a doctor with an OSF. One of my duties for my job is that I answer calls for 8 different nursing homes. The calls I take are from nurses with issues on a patient that may need orders. You would think working in the nursing field, nurses would know the correct way to call a doctor and report a condition change on a patient, but many nurses really do not. I'm going to demonstrate the correct way to contact a doctor or his nurse on a patient with a change of condition. First, when you're working as a floor nurse and your nurse's aide notifies you that one of your patients just does not seem right, the first thing you must do is go assess that patient. After you have assessed your patient, before you call the doctor, you fill out an SBAR communication form. This form is to ensure you have assessed your patient correctly and you have all the information that you will need to give the doctor or his nurse in order to get appropriate orders. The SBAR first starts out, hope I was on the right page. The SBAR first starts out with the situation. In this situation, you would list condition changes, the symptoms the patient is having. You would also list, if you know, the onset of the condition change. You could also put what makes the condition worse and what makes the condition better. Second is the background. In the background is where you would put your primary diagnosis, what the patient's primary diagnosis is, and then also any other pertinent history. So say if you have a patient who is having shortness of breath and you know that patient has congestive heart failure, you would want to put that on here so the doctor knows that that may be a reason for the shortness of breath. You'd also list any allergies, and then what I think is the number one thing on here is the vital signs. It is very important to list the vital signs. Many nurses, I have found, do not get these, and I am on hold often waiting for the nurse to run and get vital signs on a patient, so that's very important. The second page, you would just go down. The second page has mental status changes, and then you would just check the box for whatever is appropriate for your patient. So if they have increased confusion or unresponsive, we hope not, you would mark those. There's also a spot to write any other mental changes that may not be on here for you to check. Then the next thing is the functioning status change. Here you would put if they have more assistance, they've been needing more assistance with their ADLs, which is activities of daily living. So say usually a patient doesn't need help feeding themselves, and today they are. So that would be something you'd put because that is a condition change. Or if they have slurred speech, trouble swallowing, and then respiratory. Here's where you put they having shortness of breath, labored breathing, and our patient that we're going to call about has shortness of breath. Number 4 is GI problems, gastrointestinal problems, or abdomen problems. If they're having nausea, vomiting, diarrhea, abdominal pain, you put all of that on here. Then number 5 is your GU, or your urine changes. If someone's having painful urination or blood in their urine, you would again mark it. Anything that's appropriate for what's going on with your patient. Next down here you have your recent lab results. Here you would put anything such as if your patient has painful urination, but yesterday you already got a urinalysis on them and it was negative. Then here, that's where you would put your analysis, the date, results were negative. That way, the doctor knows that it's possibly something else that's causing the problem. Then the last page. The last page is for the nurse to write what they actually think is wrong with the patient. It's very important. And then also what they're requesting. A lot of nurses do not believe that the doctors want to know what it is they want, but I've found that they really do. They want to make sure that they do have competent nurses that are actually thinking through the process. So now we're going to call the doctor. So, yes, Dr. Smith, this is Christine calling from Washington Christian Village. I'm calling about Eileen Word. Today she has complained of productive cough with green sputum. She is wheezing throughout her lung fields. Her temperature is 101.2, respirations are 27, and labored. She is complaining of shortness of breath. Her blood pressure is 125/75. Her pulse is 84. Her pulse ox was 85% on room air, but then I applied 2 liters of oxygen. It is now at 92%. I'd like to get a chest x-ray and do a lab, CBC, to see if her white blood count is elevated, see if she has an infection. When the doctor gives you any orders over the phone, you always repeat the orders back. Okay, yes, doctor, I get a chest x-ray, a stat, CBC, which means immediately, start DuoNebs every 4 hours while awake, times 5 days. Just thank you, doctor. Again, it's always important to make sure that you're not wasting the doctor's time and you make sure that you have everything in place. You really should use the SBAR. It really makes sure that you have all the information that you need for the doctor, and it really walks you through making sure that you assessed your patient and did not miss anything. I'm going to shut it off.